Mr. David Malloy, 63, has been in for his annual review. He highlighted what he wanted to discuss, including wanting to lose weight, but finding it difficult. The GP has discussed lifestyle options which they agreed together. The GP updated blood tests and suggested he monitor his blood glucose at home until the next appointment. Following his annual review and results of his HbA1c tests, Mr. Malloy's glycemic control is not improving and remains at 69 millimoles per mole. He has now been with the GP for 15 minutes. The patient has discussed some of their health concerns and the GP has already covered lifestyle options.
Right, so we've been talking about trying to get your blood sugar levels down for some time now, and we've just looked at some lifestyle options and we've discussed some new things that you might want to try. I think you mentioned that you were keen on.
Yeah, that's right.
As we've just discussed, your HbA1c levels have been a bit high the last few times that we've met, and we've talked about that a few times. And we've talked about your home testing, which has also been a little on the high side. Now I know that you know the real benefits of getting your levels down to under 58.
Yeah, I realise that if I do get the levels down, it's better for my eyes, my feet and my kidneys. I'm eating much more healthy and taking the tablets.
That's great. And you're right, the benefits of the tablets are really helping you at the moment. But I wanted to discuss some ways that we could potentially move forward. Are you okay discussing that?
Yeah, sure.
So it's good that you've been working hard on your physical activity and on eating well. But in terms of tablets, we've pretty much got you on everything that we can at the moment. There are no more tablets to give you.
Yeah, I'm on 4 at the moment.
Exactly. Now, what I'd really like to discuss with you is the possibility of starting you on insulin. Do you know much about insulin?
Insulin, that's for type 1 diabetes. I'm type 2. Or are you saying that I'm now type 1? I don't like needles, and I go out a lot with friends and I can't be nipping away to inject myself. I really don't like needles.
You may have encountered some of these barriers. Coming up with new solutions for dealing with challenging situations can be particularly difficult in the heat of the moment. Forming an implementation plan for a clinical action ahead of time by identifying an anticipated barrier and linking it to a specific new solution can allow you to confidently address the barrier when it presents itself. Here is an example of an implementation plan in action that you could consider alongside those that you just formed, if relevant and helpful. The key is having a plan in place that helps you address barriers relevant to you.
I don't like needles, and I go out a lot with friends and I can't be nipping away to inject myself. I really don't like needles.
No, it doesn't mean that you're type 1. A lot of other people with type 2 diabetes take insulin in combination with tablets, sometimes maybe to help with their levels when tablets just aren't quite doing the trick by themselves. So I understand your concerns, but I'll talk you through it. What is it about the injections do you think that you're concerned about?
I just don't like needles.
I can understand that. It's actually probably a bit easier and less painful than the glucose testing that you're doing at home. What I could do is we've got a dummy injection. It's just water, but we could try this and we'll see how you go with it.
Yeah, let's give it a try.
Okay. So we've got an insulin pen here, which is just filled with water at the moment, so nothing will actually happen. But we will talk you through things like the doses for the injection. All I want you to do, pop the cap off and then just sort of pop it into the side of your stomach. Lift up your shirt, you'll pop this into your belly and press on the top. See, pretty straightforward. How was that?
Well, I did feel it, but it wasn't as bad as I thought.
Okay, so now you've done that part, if we are looking to move you onto insulin, we need to talk about how we go forwards with that.
Okay.
The patient is then started on insulin in line with nice guidelines. This implementation plan is just one possible example that may or may not apply to your practice. Having a clear implementation plan for yourself on how to deal with anticipated barriers to initiating the next step of therapy will allow you to confidently provide the care that you want.